Okay, so we're talking about healthcare, but I just want to say that I have been seeing reports of these town hall meetings, and basically, I think everyone is acting like a bunch of jerks and interrupting each other and not being respectful. And I think this whole deal is so complicated to begin with. How about we just try and suss it out and figure out how we feel about it? We've got this little window now where everybody's going home to their constituents.
I love you so much for saying that.
But I am thoroughly verklempt. I read part of the bill. It's really long. I have fears. Write them down.
I can't wait. Okay, tell me what they are.
Fear number one.
Yes.
If I'm paying attention to my media, my guys, there's a
on Fox Noise.
Well, and
that's what MSNBC
and other
says.
Places.
Okay.
And other places.
Yes. Okay. Tell me.
This is a subversive plan. It means socialized health care. It doesn't mean free market. It's going to put the healthcare companies out of business. It's going to ration care for the elderly.
Oh, you're going so fast, okay?
The quality of our care is going to diminish. We're going to have to wait in giant lines.
That's okay.
That's a start. Okay.
Woo!
So respond and then tell me what your fears are.
Well, I voted for Obama because he was for a single-payer system, which you know is off the table.
Thank God.
No, single-payer system is what Medicare is. So when everybody...
But you have an option.
Yeah, but
also...
when everybody is saying keep government out of Medicare, let's just be clear.
Yeah,
the government runs Medicare.
Well, who's everybody saying that?
At those town hall rallies,
again,
keep government out of Medicare. That's just crazy talk.
Right.
Okay?
Yeah, okay.
So when we talk about socialized medicine, Medicare is an example of a single-payer socialized system. So originally that's what Obama was for, but he was gauging the country wasn't ready for that. So single-payer...
He didn't want to do the Clinton thing and write the bill and try and ramrod it.
Exactly.
Right, okay.
And so single-payer was never at the table. But you know who's at the table? The insurance companies, the big drug companies, the doctors, the nurses, the hospitals, the AARP, the Republicans and Democrats, they're all at the table right now.
Trying to make us feel good
right,
about...
so hooray for us. I'm very proud of the Republicans that are still at the table.
So we have to figure out now.
Let's talk about cost. Do we both agree that the cost of healthcare needs to come down?
Yes. Why can't we just get the insurance companies to get on board?
Well, we've been asking them really super nicely for a long time, and you know what they say?
No.
Yeah, no.
Okay.
So here's a really fun fact, okay? Do you know where we rank in terms of all the healthcare systems in the world?
Number 1.
37.
That's
okay?
not good. Okay.
So let's just pretend for a second. You know who ranks number 1? France. They have a socialized healthcare system, okay? And France spends half the amount of money per person that the United States does.
But what's the quality? I only care about the quality.
Okay, so
this
is the World Health Organization's ranking of the world's health systems based on quality, and we're 37.
Which is not acceptable.
Okay, good.
In the most powerful country in the world.
Exactly.
Right.
So we can agree there's something wrong with our system.
Agree. Now, what's going to pay for this?
Well, 2/3 of it's already covered.
By what?
By existing money in the system.
Okay.
It's existing. There's no increased taxes. 2/3 of it's covered.
Are we sure about this?
Yes, we're sure. Check for yourself.
Okay.
Go to whitehouse.gov. And
so we know that the current system is going to cost us $1 trillion. The new system is going to cost us money, period. Do we have the money in a recession to do this big overhaul right now? And how are we going to pay for it? And how are my kids going to get saddled with this bill?
We can't afford not to do it. We're going to go bankrupt as a country if costs keep escalating and the insurance companies keep ripping us off. The insurance companies are going to bring down costs if there is a public option to compete with them, because otherwise their costs are going to continue to escalate.
With the public option, because the government can throw as much money as it wants to,
true.
and it's our money that they're throwing.
I'm not going to choose the public option, and neither are you. Just like I don't choose public school for my kids, I choose private school. But I like the fact that the public school option is there, and you know why? Because every other kid in the area goes and gets an education.
I can tell you right now. I got it. I can tell you right now, though, that the fear of the right is that this is all smoke and mirrors as a stepping stone.
A stepping stone to universal coverage.
Right.
Yeah, that'd be so bad.
Well,
Well, you know what their job is?
Yeah.
Is not to fight every step of the way, just saying no for no's sake. Their job is to figure out a smarter way, a uniquely American way to solve the problem.
And
right
we can
now,
agree. And I want someone to please explain to me,
I agree.
a mom in America, what in the heck this means fiscally and as the quality of my health care. And I don't think we have that answer yet.
But instead of all these people feuding at town halls, let's give our politicians kudos for still being at the table and still trying to work this thing through.
Not letting the timetable of the weird August thing push them into making a decision.
They need a timetable. It's been 40 years.
Right,
It's not a quick decision.
So what do you guys think about this debate? It is continuing, and it will do so again in the fall. So log on and let us know what your thoughts are, and we will see you again here on Oh Mama Monday.
And just one last note,
she
as
can't-
moms,
can't
just to
have the
bring it
last
home.
word. Okay, go
Yeah,
on.
I'm sorry.
Do
Just
it.
to bring it home, what this thing is all about really is staving off our system from being about treating us after we're sick, right? And we need to do a better job as parents to raise healthier people. And how we do that is by food, exercise, and hygiene, and every other thing that goes into it. And that is what we can control. Moms, we can actually bring down overall healthcare costs by having healthier kids. So talk to your pediatricians this fall and make sure that your kids are covered and have the right vaccines or not. Have that conversation however you want and let us know what they say.
But we still want to talk to you about healthcare, so join in.